Hello everyone. Now let's let's move on to liposarcoma. So liposarcoma is one of the most common sarcomas of adulthood. It occurs mainly in people in their 50s to 60s, that is, sixth and seventh decade. 50s to 60s means 50s means sixth decade, and 60s means seventh decade of life. In the deep soft tissue of the proximal extremities and in the retroperitoneum. Um, Retroperitoneum. Pathogenesis. The three distinct subtypes of liposarcoma, well differentiated, mixed, and pleomorphic, have different genetic aberration. First of all, talking about well differentiated liposarcomas, it harbors amplification of chromosome region 12q13 to q15, which includes p53 inhibitor MDM. That is, p53 is inhibited by MDM2, so the cell proliferates. p53 is known as guardian of the genome, um, as you can recall from the general pathology. In mixed liposarcoma, a fusion gene generated by uh, T1216 translocation arrests adipocyte differentiation, leading to unregulated proliferation of primitive cell. And in pleomorphic liposarcoma, have complex complex karyotype without reproducible genetic abnormalities. So, in well-differentiated, um, there is amplification of a gene MDM2 gene in chromosomal tubular. In mixed liposarcoma, there is uh, translocation, 1216 translocation arrests adipocyte differentiation. So there will be unregulated proliferation of primitive cell, and pleomorphic liposarcoma, they have complex karyotype. And talking about morphology. So liposarcomas are histologically divided into well-differentiated, mixed, and pleomorphic subtypes, as we have discussed. Well-differentiated liposarcoma, how they look? They are composed of mature adipocyte with scattered or typical spindle cell. Figure. Let's see figure. Here is the figure from 10th edition. You can see mature, well-differentiated liposarcoma. This is liposarcoma, well-differentiated subtype, which consists of mature adipocyte and scattered spindle cells with hyperchromatic nuclei. This blue color are nuclei. Let's see again. This is figure from 9th edition. You can see this blue color all are um, hyperchromatic nuclei, and this white are adipocyte, well differentiated adipocyte. And talking about mixed liposarcoma, this is characterized by abundant basophilic extracellular matrix, that is basophilic blue color, arborizing, branching capillaries, and in Robbins, the table of Robbins mentions chicken wire type of vessels, and primitive cells at various stages of adipocyte differentiation resembling fetal fat. Let's see in figure. You can see the basophilic. You can see basophilic ground substance in myxoid. This is myxoid liposarcoma, which consists of basophilic ground substance, uh, rich capillary network. This is red color. This is red color are all rich capillary network, and scattered adipocyte, immature adipocyte. These are immature adipocyte, fetal like, and more primitive round to stellate cell. Pleomorphic liposarcoma. They are characterized by sheets of anaplastic cell with bizarre anaplastic cells means lack of differentiation. Anaplastic means, and bizarre with bizarre nuclei, admixed with variable number of immature adipocyte from lipoblast. There will be immature adipocyte, which is named as lipoblast. This is pure. Now, talking about clinical feature, liposarcoma is recurred locally and often repeatedly, unless adequately excised. So, we should adequately excise it so that we can prevent recurrence. Well differentiated tumor can be indolent, while pleomorphic liposarcomas are aggressive and frequently metastasize. That is, pleomorphic will be frequently metastasize. The behavior of mixed tumor is intermediate between these extremes. That is, it will have intermediate character between well differentiated and pleomorphic liposarcomas. Thank you.